Mic was muted as always. Welcome back to another live stream, everybody. Got a lot planned for the show today. A couple different stories I want to talk about. I find all of them interesting, and I'm pretty sure all of you will too. So I'm gonna wait for a couple more people to join the live stream. Give me 1 second, and I have a couple more things to do behind the scenes to set up for the first story that we're going to cover. So just give me 1 second on that. So everybody who's here already, I would greatly appreciate if you could share the stream, let people know we're live. We have some pretty cool stories to talk about. Um, the story that's in the title of the live stream uh, is me basically. I'm getting real tired of the stale commentary from some of the biggest people in left media because there's a bunch of evidence to refute um, or to at least give them pause about the position that they've taken on the vaccine, or at least to make them more critical of the pharmaceutical companies. Uh, but they just act like that doesn't exist, and they just continue to use talking points off of the same data from like a year ago and acting as if nothing has happened in between then. So I'm gonna get into that a little bit. That's clearly the first uh, title. That's the title of this live stream. So, like I said, I have a couple more things to do behind the scenes, which I'm trying to do while I'm talking to you. Uh, let's just hope I don't make a mistake, but we'll find out soon enough if I did. Uh, so, everybody, let me know. Oh, and I got some real big shout outs to give uh, after I'm done with this. Because I have some things planned for the next couple days. Wow, that was a lot of stuff. I did not realize how many. Oh, 16 people in the live stream already. Hello, everybody. What's happening? Uh, like I said, just give me 1 second. I have some things to do behind the scenes to set up for the first story. And the first story that I might be talking about actually isn't even the Kyle Kulinski story or segment that I'm gonna do because there's some information that I think is relevant before we get into that conversation about Kyle, and this has to do with the Pfizer whistleblower. That's gonna be the first story we talk about. One more, almost there, guys. Oh shit. All right. Um, see where pilgrims in the chat. Uh, decult, deculturation. Thoughts on Sean's Jimmy Dore video. I don't know who Sean is. And I'm not sure what Jimmy Dore video you're talking about. But thanks for joining the live stream. I don't think I've ever seen you in the live stream. I see Independent Left News is in the live stream. Like I said, I got a big shout out for them in particular, but also for everybody else who donated over the last couple of days towards the goal that I set up. So give me 1 second. Um, and I just have to share the stream on Twitter. Ooh, that did not work out how I thought it would. Okay. All right.
Ever wonder why so many people say they want to learn how to sing, but very few?
Y'all are waiting.
Google Career Certificate.
So everybody, let me know. Give me 1 second. Give me 1 second. I have to. God damn it. Okay, 7 minutes. Y'all have waited longer than that. Almost done, I promise. Okay. I'm not looking at the chat right this second, but deculturization, I hope you responded, or I hope you elaborated on your comment that you left. Um, Ashura, he says you got ads running now, so you back to being monetized. That would be a hell no. So apparently YouTube they run ads. What the fuck is going on here? YouTube they run ads on all the videos on YouTube, regardless if the channel's monetized. So if they run ads on my videos right now, as they are doing, I just won't get any of the ad money. So that sounds 100% legit to me. Let me know what you all think about that. Uh, all right, all right. One more thing. Um, all right. All right, everybody. Thank you for your patience and putting up with all of that. Um, you have my full attention at the moment for the rest of the stream. Before I start, I'll give you a quick little uh, explanation of the stories that I was going to cover already. First, I want to give a shout out to everybody who donated. If you remember last week when I was live streaming, I mentioned that I was invited to be part of the Fred Hampton Leftist General Strike Summit. It's coming up this weekend, but I needed money for the hotel room so that I could set up the studio and have a place to record. Um, and a couple people in my audience, they came through and donated during the stream. But Independent Left News, and I'm not sure if any of you all know who that is, but they host like a newsletter for left news, like independent news, whether it's reporters, commentators, and things like that. They host a newsletter. Uh, they're really big on Twitter right now, and so he does a lot of work promoting smaller channels, even bigger channels too. Um, through, like I said, the newsletter. They have a Discord, uh, and things like that. So, and they've always shared my content, and I've always been grateful for that. But they made very generous. Uh, uh, Independent Left News made a very generous donation uh, to make sure that I can get a hotel room for a couple days so that I could join the General Strike Summit and try to fit in Hard Lens Media and other appearances that I wanted to do. So incredibly grateful for that, for the generous donation from Independent Left News. And they also started a new uh, Independent Left News outlet. So before they were doing a newsletter where they would just find their like highlights from different content creators during the week and send it out to the people in the email list. And they also started their own thing, What We Missed, that they like a podcast that they do once a week. But now they have a network with a bunch of smaller content creators contributing to the network, and they're going to use it as a way to really boost smaller content creators in the space. It's called at Indie News on Twitter. That's the at name. It's Indie News Network is the name of it, and I'm excited for it. I hope you all are excited for it. If you guys have followed their work up to this point, you should know that this is going to be very great. I don't know how to explain it. A very great advancement in left new media, because it's always great when the new networks grow and how people collaborate and push back against censorship, which is another great a plus side of that. So I'm very grateful for the donation, and I'm also very proud of the work that they are doing with Indie News Network too. So got that out of the way, and again, I'm incredibly grateful. Incredibly grateful for everybody who contributes to the show, because I literally couldn't do it without all of you. So all the people who contribute financially, all the people who show up, share the live streams, incredibly grateful for all of it. So we're gonna get into the live stream now. Decent amount of people in the stream at damn near 1 o'clock on a Wednesday night. So grateful for that too. So the first story. Uh, oh, before I get into this first story, let me just see what's happening in the chat. Uh, um, uh, I see Noli D's in the chat. What's happening? Noli, I texted you the other day. I'm not sure if you got it. You sent me like some information, like contact information, and I texted one of those numbers. I'm not sure if you got it. But thank you for the PayPal donations. Robert Durden's in the chat. You and Noli D, Robert Durden, they are also part of the Indie News Network. So great work. I forgot to mention some of the people who were on there, which was pretty dumb. Colin, who's been on the ground reporting at some major like big events like March for Medicare for All. He was also at the little sleepover that the Justice Democrats had at the step of the Capitol, and he was asking tough questions. Who else was Who else is part of the Real News, the Indie News, not Real News, Indie News Network? I'm blanking on his name. Kobe, who was also independent reporter and does commentary, hosts his own show. He's also part of the Tara Reid is part of the Indie News Network. I know she was writing articles at RT. I think she's still doing that, and she's still part of the Indie News Network. So many great people. So many great people. Let me see what else is in the chat. Ashura asked about the dislikes. YouTube getting rid of the dislikes. I'm going to actually do another. There was so many things I wanted to talk about, but I was like, I just can't fit it all in one live stream. So I'm gonna. I have already had the stories lined up for that. I'm gonna do tomorrow, and that is one of them. Robert Durden has a list of some people. Uh, Tara Reid, Black in the Empire, also doing great work on Twitter. Blue Moon Red Wine, who I also recently followed and has been following me for a while. Uh, Noli D is with Real News and Indie News Networks. Yes, there's an important distinction. Um, all right, so I'm going to get into the first one. So the title of this video is the segment. The title of the live stream is the segment I'm gonna do about Kyle. But before I get into that, I want to add some more context to the discussion about the vaccines and how a lot of people who are supposed to be in independent media are falling asleep at the wheel here, and where there should be a lot more pushback and criticism of big pharma and the COVID response from the government. It's just a lot of oh well, I've cherry picked some data that I think confirms my point of view, and I'm just going to not even engage with all of the mountains of evidence and research and studies that are blowing giant gaping holes uh, um, in my talking points. And so this first story is just another point in why people are incredibly skeptical about getting these vaccines. So get ready for this real quick. So a couple of days ago, BMJ posted published a investigative piece that they did where a whistleblower who was in a pretty high role in the Pfizer COVID-19 vaccine research. Uh, this whistleblower who was recently fired, or who was fired, for raising concerns about the things that she saw being done in during these trials. Uh, this whistleblower went to BMJ with a whole list of concerns and corroborating evidence uh, as to what's going on with these trials, or specifically with the trial for Pfizer's vaccine. And the way that they did the research, they basically contracted out the research to smaller companies to conduct the trials uh, for the vaccine. And this person was a regional director for one of the companies that was in charge of the trials for, I believe, over 1,000 different patients, and in total there were 44,000 patients in the trial. So now let me. I have some. I have some quotes from the article that I want to share with you all because they are pretty. They're pretty damning. All right. Actually, give me 1 second. Give me 1 second. Having some slight technical issues. All right. Okay, glad I got that figured out. Just give me a couple seconds, guys. Yeah, it's almost done. I decided to rearrange the quotes for the from the BMJ article. I want to make sure I get all this information correct because it's pretty fucking explosive. All right, I got him. Sorry, everybody. I'm the one man band here, tech support, talent, and all of that. All right, so let's do this. All right, so this is just a quick summary of the article. Then I'm gonna get into it. Sorry, y'all. Give me 1 second. I'm trying to make it bigger for you. That is not it. All right. There we go. So it says, book. It says Brooke Jackson, a now fired regional director at Ventavia Research Group, revealed to BMJ that vaccine trials at several sites in Texas last year had major problems, including falsified data, broke fundamental rules, and were quote slow at to report adverse reactions. Um, that it sounds bad, but you wouldn't believe it gets much worse. The details of this gets much worse. So let me get into some of the quotes from the actual article for you all. Oops, already did that. All right. So, quote, a regional director who was employed at the research organization Vantavia Research Group has told the BMJ that the company falsified data, unblinded patients, employed inadequately trained vaccinators, and was slow to follow up on adverse events reported to Pfizer's pivotal phase 3 trial. Staff who conducted quality control checks were overwhelmed by the volume of problems they were finding. After repeatedly notifying Ventavia of these problems, a regional director, Brooke Jackson, emailed a complaint to the U.S. Food and Drug Administration, the FDA. Ventavia fired her later the same day. Jackson, so this person was hired to oversee the the trial for Vantavia Group, who, like I said, was responsible for over 1,000 patients in this trial, and I believe over 13 facilities that they were managing, or the number. I'll have the exact number later on in the article. But she was bringing up multiple concerns, and not just her. Other people who were involved with the trial were bringing up concerns with their higher ups, and they were being ignored, and nobody was taking them really seriously. And in fact, they seemed to be trying to suppress any of the complaints coming from the professionals. And this Brooke Jackson person, like I said, even a person whose whose concern should carry even more weight in this organization, because not only was she the regional director, but she's been a auditor of trials, which is also going to be highlighted later on in this article, for years. So her profession is auditing and making sure that pharmaceutical trials are being conducted properly. So when other people, including herself, were presenting these problems, they were being ignored. And then when she finally took the step of going directly to the FDA about it, because the FDA is supposed to be the one ultimately providing oversight, the same day she sent the letter to the FDA, she gets fired. And everybody's gonna act like there's nothing wrong. There's nothing to see here, right? There's nothing to see here. But I'll have more to add on this as I get into this. So let me move on to the next quote I want to share with you all. All right, so here's the next quote. It says, but Jackson has told the BMJ that during the 2 weeks she was employed at Ventavia in September 2020, she repeatedly informed her superiors of poor laboratory management, patient safety concerns, and data integrity issues. Jackson was a trained clinical trial auditor who previously held a director of operations position and came to Vantavia with more than 15 years of experience in clinical research coordination and management. Exasperated that Ventavia was not dealing with the problems, Jackson documented several matters late one night, taking photographs on her mobile phone. One photo provided to the BMJ showed needles discarded in a plastic hazard bag instead of one of those plastic box. I don't think I have the quote to that, the end of that quote. So the next graphic I want to share with you all. So this is where they get into how some of the data might have been compromised because these were supposed to be blind studies. So what that means is the people conducting the trials, the researchers and the doctors conducting the trial, they aren't supposed to know who has the vaccine and who has the placebo, in order to make sure that the data isn't biased or skewed in any direction and it's as accurate as possible. That's why these studies are supposed to be blind. But one of the concerns that Jackson raised was that these tests were being unblinded. She gave an example of how they were just they would have the information on who has what just laying around open for anybody to see, even the people in the researchers conducting the trial, and who would have had a direct impact on the if they had a bias would have a direct impact on the data. And she said it wasn't just like a one-off instance of people just leaving these like documents laying around in the lab. There was so the entire and I'll get into that right now. This is what this next quote is about. Quote, early and inadvertent unblinding may have occurred on a far wider scale according to the trial's design. Unblinded staff were responsible for preparing and administering the study drug, Pfizer's vaccine, or placebo. This was to be done to preserve the blinding of trial participants and all other site staff, including the principal investigator. However, at Vantavia, Jackson told the BMJ that drug assignment confirmation printouts were being left in participants' charts accessible to blinded personnel. As a corrective action in September, 2 months into the trial, into 2 months into trial recruitment, and with around 1,000 participants already enrolled, quality assurance checklists were updated with instructions for staff to remove the information on who got the drugs from the chart, the actual drug from the chart. So, like, just to reiterate, there, it was right there in the chart. So again, it's supposed to be a blind study to prevent any bias from affecting the data. But clearly, anybody who had access to the patient's charts, which is any researcher conducted the trial, could clearly see who got the placebo, who got the actual drug, and that was the case for 2 months, the first 2 months of the trial, or at least this phase of the trial. So let me get on to the next part that I want to share with you all. Sorry, give me 1 second. Okay, so then now this part is about how they weren't report they weren't getting to the adverse effects in time, and they weren't properly recording the effects that that were being reported in the trial. That's what this next quote is. So let me show you that real quick. It says, "quote The expectation for the study was that all queries are addressed within 24 hours." Then highlighted icon, which was somebody who's partnered with them, Vantavia, on the trial. Icon then highlighted over 100 outstanding queries older than 3 days in yellow. Examples included two individuals for which, quote, subject has reported with severe symptoms and slash reactions. Per protocol, subjects experiencing grade 3 local reactions should be contacted. Please confirm if unplanned contact was made and update the corresponding form as appropriate. According to the trial, According to the trial protocol, a telephone contact should have occurred, quote, to ascertain further details to determine a site visit whether a site visit is clinically indicated. So again, this is a small example, but they were supposed to be following up on these adverse reactions, and clearly they were supposed to be doing it every 24 hours, and in this one period, they found that there were over 100 outstanding queries that were more than 3 days old, and two of them were severe reactions. Again, these are this is incredibly. This all comes off incredibly sloppy, and with the stakes of, hey, this is potentially a vaccine that is going to be pushed onto billions of people, but yet they seem to not really be doing their job and actually coming up with accurate data on how on whether or not these vaccines work properly or are effective. And you can say it's incompetence. You can make that argument up to a certain point, because when they then now they are intentionally covering it up. So what that tells me is they know that the data is flawed, but they don't want that to be public. So now the incompetence argument, the incompetence defense goes out the window, and it looks like you're actively trying to mislead the public because you have billions of dollars at stake here in whether or not this vaccine gets approved. And that profit motive, it's so wild to me how everybody's acting like that's not part of the equation. For so many people in independent media, left media, they're acting like the fact that there were billions of dollars on the line here wouldn't it wouldn't be enough incentive for these corporations to uh, uh, conduct these trials in a nefarious way and try to rush it through, regardless of how effective these vaccines are. That is a very likely scenario, especially with the evidence that we've been presented with by this whistleblower, and it's not done yet. Uh, so now this next piece that I'm gonna show you, it's they talk about how the FDA is supposed to be overseeing these trials. They're supposed to be overseeing these testing sites, but they just they don't they are not staffed well enough to, even when there are legitimate complaints presented to them by people directly involved with these trials, when they present these complaints and these concerns to the FDA, who's supposed to be providing oversight, they just don't do it. So this quote is just an example of another case of another trial where the FDA is just completely missing in action when it comes to oversight. Give me 1 second, I'll get that for you. It says, quote, one example of Circare, which is like a citizen's like it's going to explain it further on in the quote. What in one example, Circare and the U.S. consumer advocacy organization Public Citizen, along with dozens of public health experts, filed a detailed complaint in July 2018 with the FDA about a clinical trial that failed to comply with regulations for the protections of human participants. 9 months later, in April 2019, an FDA investigator inspected the clinical site. In May this year, the FDA sent the trialist a warning letter that substantiated many of the claims in the complaint. It said, quote, it appears that you did not adhere to the applicable statutory requirements and FDA regulations governing the conduct of the clinical investigation and protection of human subjects. So, like I said, what that example shows is the FDA, who is supposed to be monitoring this, and again, everybody's acting like, oh, FDA approved it, and we're just waiting for the FDA emergency authorization, and when the FDA approve it, there's no question to be had here. These are the serious people in the room. These are the adults in the room, and they're doing their job. They're on top of their job. So once the FDA says it's all right, we all need to. There's no question, no further questions to be asked. Well, that example that they just provided there was, again, this is different from the Pfizer whistleblowers. It's another situation. But again, they had another whistleblower come to them directly with a complaint about exactly what they're seeing being done wrong in the clinical trial. And then 2 years later, after the trial's already fucking done, they send a warning letter saying, hey, look, we got a complaint 2 years ago, and it looks like you weren't doing what you're supposed to be doing 2 years ago. Wow, that's some great oversight that you're doing. And they go on to talk about how the FDA is just chronically underfunded, and it is like logistically impossible for them to do their job. And that's not an accident. That's because the people who run the FDA come directly from the pharmaceutical industry that they're supposed to be regulating. And then on top of that, the funding from the FDA comes from those same pharmaceutical companies. So it is. It seems to be intentional, a way of avoiding regulations, to just completely understaff the agency so that they can't even do their job, regardless of whatever regulations and rules they have on the books. So that goes to show you how lax the FDA is at when it comes to oversight in general. So let me try to find you guys the next quote that I want to share with you all. It says, quote, there's just a complete lack of oversight of contract research organizations and independent clinical research facilities, says Jill Fisher, professor of social medicine at the University of North Carolina School of Medicine and author of medical research for hire, the political economy of pharmaceutical clinical trials. So again, somebody who has direct knowledge of this just says the FDA is just not doing their job and they're not overseeing these clinical trials, which very much is in alignment with what this whistleblower from Pfizer has come out and said. So let me get you guys the next quote from the BMJ article. This one might be a little harder to read actually, but I can't show it to you any other way. All right, so this in this part they get into the specific concerns that were in that letter that she emailed to the FDA. In her September 25th email to the FDA, Jackson wrote that Vantavia had enrolled more than 1,000 participants at three sites. The full trial registered under the, that's I believe that's the trial name or whatever. I'm not a research expert. Enrolled, so that's the name of the full Pfizer clinical trial for their vaccine. Enrolled around 44,000 participants across 153 sites that included numerous commercial companies and academic centers. She then listed a dozen concerns she had witnessed, uh, including sorry, y'all, give me 1 second. Quote, all right, so these are the complaints. Participants placed in a hallway after injection and not being monitored by clinical staff. Lack